Federal Drive is presented by GEHA, Government Employees Health Association, proudly providing health and dental benefits to federal employees and their families. Visit GEHA.com.
Staff of the Office of General Counsel at the Department of Health and Human Services report they have been notified of a planned reduction of their regional offices from 10 to 6. That might not sound too surprising given all of the other workforce cuts happening across the government, but these folks are on the front lines of preventing waste, fraud, and abuse in the Medicare and Medicaid programs, a high priority for the Trump administration. Here with more details on this story is investigative producer with the Project on Government Oversight, Maren Macklis. Maren, thank you for joining me.
Yeah, thank you so much for having me.
I want to talk about this new article that you've written where you highlight the potential increase in waste, fraud, and abuse due to the cuts in oversight, specifically the Office of the General Counsel at the Department of Health and Human Services. Can you tell us about the planned cuts and why, from your perspective, this poses such a danger?
So offices of general counsel kind of exist throughout the executive branch at different agencies, and they're basically acting as legal counsel for that federal agency. The interesting thing about this specific Office of General Counsel in HHS is that it has these regional offices that kind of act as a watchdog for the Medicaid and Medicare programs. So they're not only protecting the interests of the federal government, but they're also protecting the interests of patients. So that's why this is kind of a big deal. But basically back in March, HHS announced that they were going to be cutting 6 of these 10 regional offices without much explanation. It was kind of a minutes-long phone call that left a lot of people in shock. Insiders there was no room for questions. Insiders didn't know what to do, what to tell their staff. And there was just a lot of confusion. And since there's not really been much of an explanation for cutting these specific offices, there's kind of this general explanation that they're trying to cut waste, fraud, and abuse. These offices are kind of the exact offices that prevent waste, fraud, and abuse within the Medicare and Medicaid systems. So it's kind of left a lot of people shocked. And the staff that I've spoken with have said that this will result in a 300% increase in workload for the remaining staff. And that, everyone is pretty confused that I've spoken with.
So this is not just a regional alignment, for example, going from 10 regions to 6, but bringing everybody to new places so that they can consolidate work. This is an actual reduction in the number of offices and people. Yeah, it is. So can you articulate a little bit more about how these particular folks in the Office of General Counsel provide oversight over Medicare and Medicaid? What exactly do they do?
Kind of just to give a little bit of perspective, HHS is one of the largest budgets in the federal government, and 90% of that goes to the Centers for Medicare and Medicaid Services, which administers those programs. And what these offices do is they basically are the enforcement behind the Centers for Medicare and Medicaid Services. So they basically work on administrative judgments. They help with recovering misspent dollars, taxpayer dollars. An example of kind of the work that they do is they work with the Justice Department and the HHS Inspector General on a program that specifically targets fraud and abuse of healthcare systems. And in fiscal year 2023, OGC, which is the Office of General Counsel, received $8 million to help with that program and helped to establish more than $880 million in judgments, settlements, other types of recoveries. And that's a 10,000% return on investment. So these are kind of small but mighty offices.
Do we have a sense of what the timeline of this restructuring and reduction is going to be?
Yeah, so the announcement was made back in March. And during that announcement and kind of the following correspondence about the closures, it was named that in September of 2025, these offices would be completely closed. There was an option for staff to leave early through voluntary early retirement, and that the option to do that was between April, mid-April to early May. So the expected closures will be in September.
I'm speaking with Maren Macalis. She's an investigative reporter at the Project on Government Oversight. So you've mentioned a couple of times, Maren, that this portion of the Office of General Counsel is really key to defending the Medicare and Medicaid programs against waste, fraud, and abuse. How do you square that with the Trump administration's claims that they want to actually reduce waste, fraud, and abuse in the Medicare and Medicaid system?
Yeah, it's really confusing. I think it doesn't really square. I think the mentality of acting fast and breaking things could have massive repercussions, and this is maybe one of the examples of how that could be the case, especially considering these offices oversee one of the most expensive federal programs. We haven't received any comment from HHS on the rationale. Maybe they thought that these OGC regional offices were just added bureaucracy or slowing things down because they take a long time to kind of go through all of these different Medicaid and Medicare claims in order to identify whether or not they're fraudulent or if there's been abuse. But this is kind of meticulous work, and it requires these lawyers to do it. And no one else is there as a stopgap to help mitigate this fraud and abuse. So they're really crucial. And, insiders told us that this was a direct attack on the integrity of federal law enforcement in healthcare.
The reconciliation bill that was just signed into law puts a whole lot of new requirements on especially Medicaid recipients, many more claims, much more paperwork, much more administration, a higher administrative burden. Would it have been the work of these offices to help oversee the administration of those new requirements?
I think absolutely. These offices are basically helping to enforce the legal framework for any changes that are made to these programs. So it would have a massive impact. It will have a massive impact on the ability of HHS to detect waste and fraud.
At the same time as they're increasing the burden and the workload, so there'll be fewer people to do an increased workload. Is it too late to make any changes? Is there anything that could be done at this point to mitigate these negative impacts?
Not that I am aware of. I know that as I wrote the story, there was no official reduction in workforce. However, the statement of organization did name only 4 remaining regional offices. I think it's up to the constituents of these different lawmakers to kind of reach out and explain because these are regional offices, so they're impacting very specific parts of the country. So I think that the impact of this will be felt eventually. And when it is, it's kind of up to those who have made these decisions around Medicaid and Medicare to see how to potentially remedy it. Well, but it's all kind of a prediction from here.
Obviously, POGO is interested in oversight and effectiveness. Are you seeing other places in HHS where there are similar sorts of decisions about organizational alignment, especially folks who are in the enforcement space?
Yeah, that's a good question. I mean, I think as journalists, we've been kind of looking everywhere. There's different cuts being made all over the federal government. That's kind of attacked efforts to watch for waste, fraud, and abuse. And this is just one example. I'm not entirely sure if there's been others within HHS. I know that there's been a lot of cuts to resources and research that will have massive impacts on the way that different communities are served in the future. But yeah.
I've been speaking with Maren Macalis. She's an investigative producer at the Project on Government Oversight. Maren, thank you so much for joining me with this story.
Thank you so much for having me.
We'll post this interview along with a link to her article at federalnewsnetwork.com/Federal Drive. Subscribe to the Federal Drive wherever you get your podcasts.
What makes a great leader in government? Christine Harada joins WEPA CEO Shane Canfield to reflect on her journey from aerospace engineering to the White House. In this episode, she shares lessons on public-private collaboration, leading with purpose, and why service, not power, should guide leadership.
Hello, and welcome to the Lessons in Leadership podcast. I'm your host, Shane Canfield, CEO of WEPA. Today, I'm joined by Christine Harada, former Senior Advisor at the Office of Federal Procurement Policy within the Office of Management and Budget. Ms. Harada, welcome, and thank you for joining me.
Thank you so much for having me.
You spent portions of your career working in both the public and the private sector. And from your experience, what makes leadership in the federal sector different than the private sector?
At the highest level, leadership in the public sector is very fundamentally at its core mission-driven. Right? The work is in the service of the public good, and the goals and the programs are frequently long-term, they're systemic, and they're incredibly complex. And success, isn't necessarily measured by quarterly earnings. We don't have that kind of drumbeat, but certainly more by the lasting impact that we have on Americans' lives. What's also unique about public sector is, in my view, the profound sense of history that you feel. And I think certainly I was very aware about the work that I was doing and how it builds on the efforts of those who came before me, and that future generations of leaders also depend on the decisions that were being made today. And that, for me, certainly provided a greater weight of responsibility.
That's a wonderful answer. And I was in the private sector for much of my career, and now WEPA is a nonprofit, and I really relate to what you said about being mission-driven rather than profit-driven. You've got a long-term view, and always at the core of it is serving others.
Yes.
Is there a moment that stands out to you from early in your career that influenced your leadership style later on?
I started out my career as an aerospace engineer, building satellites and airplanes. And when I first entered the workforce, my organization at the time had 120 people. We were a large company, 120 people, 4 women, and I was the only woman of color. I was also the youngest throughout the entire organization. And so, I remember having an experience when I was doing some engineering work. We had a design review, and I had seen some issues with the flight software that I pointed out. At the time, they're like, maybe it's not really that big of a concern. I was like, but in my heart, I knew that the issue was real and stayed with it. And sure enough, a few weeks later, that topic came up again, and we addressed it. Turns out my concern did indeed prove to be valid. And so it's just one of those experiences that really sank into me around ensuring that I am listening to everybody, period, end of story, within the organization. Really thinking through about how do we take into consideration opinions from all different spectra. As a third-generation Japanese American, right, I was raised to be humble, keep your head down, and work hard, etc. But at times, leadership also requires you to speak up, do so politely, with courage, etc. Even though you may be the only voice in your room, but certainly trust your voice. It also really helped shape my belief around diversity. DEI programs right now are viewed in a negative light. We're all mosaics, and they become better because you have those different experiences. And that's really stayed with me throughout the entirety of my career.
The diversity issue is a really big one coming from the insurance industry. That's an industry which is working on that. It's really a diversity of viewpoint and perspective and experiences that does influence your business. And more diverse employee bases absolutely helps. Was there a time in your federal career, perhaps when you were at OMB, that you faced what you consider a real challenge? And how did you overcome it?
One moment that really stands out in particular was when I was serving as the Federal Chief Sustainability Officer during the Obama administration. We had set, like many administrations, had set some really ambitious goals, very, very, very ambitious goals around how do we think about making the federal government's operations much more sustainable. But the challenge wasn't so much about the scale or the technical capacity of the organization. A lot of it was really centered around the funding. We overcame this largely by being very strategic, helping out with blocking and tackling with the variety of legal issues or legal questions that might have come up, like how do we address this? Certainly in the federal government, you're more often leading through influence as opposed to pure form authority, and that you really need to listen deeply, communicate clearly with folks, building out those coalitions and, engaging with your stakeholders. And I know many folks in government speak like that, but that is the truth.
As someone who's spent time in both the federal and the private sectors, what makes the relationship between the two sectors important?
Certainly, it's an absolutely essential partnership, and I would add on to that, like nonprofits or philanthropic organizations. As I mentioned before, I'm Japanese American, and in Japan there's a symbol for thunder, which looks like 3 arrows pointing, around each other in a circular pattern, kind of to represent the swirl, if you will, of clouds. And that's kind of how I view the relationship between the government, the private sector, and the nonprofit sector. The government frequently sets the vision, the policy, the direction. But of course, it's the private sector that brings the capital, the innovation, the skill set, the capabilities, et cetera, to be able to execute. Partnering with that, of course, are the nonprofits who may be supporting the surrounding society. Public-private collaboration is not just about contracts or compliance, but it's also about figuring out what's your shared purpose. That's when real transformation can and does actually happen.
In life insurance, there's a concept, lifetime value, where bringing a new insured in costs a lot more money than the amount of premium. And so when you talk to commercial carriers, it's a similar kind of thing. You need to bring them into the concept that they're going to be with us 20 years, and after 5 years, you can ride through that. But it's a concept that isn't easy for commercial businesses to understand. That's a partnership too. Very, very similar. What advice would you give to somebody aspiring to become a leader in government?
There are 3 things, right? So firstly, around leadership in government, you want to make sure that you're leading with purpose. You want to stay grounded in your values, and don't underestimate the power of relationships. Remember why you entered public service in the first place, and that'll help carry you through some of the inevitable challenges that you're going to face. Making sure that you are also investing in relationships. In government, you rarely have full control, and I think this is, in my view, more important in government than perhaps in the private sector. You are frequently leading through influence. You are collaborating with very different parties who frequently have very different agendas than you do. And so building that trust, investing in building that trust and planting those seeds earlier and along the way in your career, I think is absolutely critical. And certainly last but not least, I would say, don't feel that you have to have it all figured out on day one. Absolutely stay open to the unexpected. Say yes to the opportunities that stretch you, and know that you can lead from wherever you are. It's not just about position or hierarchy. It's about the impact that you can have.
What wonderful advice, especially in today's world, which is a little topsy-turvy. Who is one person, someone you know personally or perhaps someone well-known, that's impacted your leadership style?
The leaders that particularly stand out for me are Colin Powell, a woman named Carla Harris, who was a managing director in investment banking, and then last but not least would be my father. Starting with perhaps the more famous one, Colin Powell. I read his biography, loved his perspectives and the rules of leadership that have been particularly influential for me, right? So get mad, then get over it, share the credit, perpetual optimism, a force multiplier, things of that nature. And hearing his story was certainly very inspirational for me. And so I certainly very much look up to him and as a role model. The second person that I mentioned is a woman named Carla Harris. She's an African-American woman, became a managing director at an investment bank in the 80s, at a time when there were not that many women of color in investment banking in New York. And so she's published a book called Her Pearls of Wisdom. It's one of her trademarks. She always wore a pearl necklace, and she has Pearls of Wisdom around how can you be authentic and build relationships to be successful in super challenging environments. And she had a lot of guidance on the importance of finding sponsors and mentors. And certainly last but not least, my father is really my why for I do a lot of the work that I do in the public sector. He started out life like many other, immigrant kids in poverty. He was a strawberry farm laborer. Japanese Americans at the time were not allowed to own the land, so we worked the land. He grew up in that kind of environment. And I just think it's absolutely neat that someone who came really he was dirt poor, to say it, and his daughter ended up working in the White House twice. It's quite the American dream, and I would very much like to have that opportunity available for other people as well.
Well, wonderful. Absolutely wonderful. Christine, thank you very much for your time today and all of these learnings. It's really good, impactful. Thank you for sharing.
Oh, thank you so much for having me. I really enjoyed it.
I'm Shane Canfield, CEO of WEPA. Until next time on Lessons in Leadership.
Find the full podcast and future episodes of Lessons in Leadership on the Federal News Network app and anywhere you enjoy your podcasts.